A lot of that depends on what job you have or what condition you have. So let's take diabetes, for example. If someone has diabetes, you really should be seeing your podiatrist probably at least 2 to 3 times a year. And that's because a lot of folks with diabetes may not have good feeling in their feet. And you want someone looking at your foot, at least every few months to make sure there's no problems that are happening. Now, let's take, for instance, someone that maybe works in a factory or is on their feet all day, or they work at Amazon and, they're in this huge warehouse. You may want to see me twice a year because more than likely you're going to need some type of good shoe or some type of orthotic to make sure you're able to do your job efficiently. So, it can range depending on the condition or the job that you do. Everyone thinks because they're on their feet all day, they're doing a lot of stuff, their feet are in shoes, that, hey, this little aching that I have is normal, and it's not. Now, let's say that you just went and ran 2 or 3 miles and you're not used to doing that. Of course, your feet are going to be sore, but your feet should not be hurting for 2-3 weeks. You shouldn't have a little swelling. You shouldn't have this little redness in this area. If you're having foot pain or something looks off, then that's not normal. And I see people all the time. They come to the office and they say, hey, yeah, I've been having this foot pain for 3 months. And it's like, no, you shouldn't have this foot pain for 3 months. And so if something is bugging you for more than a week or two and it's getting worse, you need to get into the foot doctor.